What do I like about being a psychiatrist? I'm Dr. Anthony Claude. I'm a board certified psychiatrist. One of the monks asked me what I like about being a psychiatrist. One of the monks told me about a story where a guy who has a history of bipolar disorder, but more recently wasn't compliant with medication on and treatment, recently fled to the monastery to confess a sin they did, even though they're not supposed to confess at the monastery, but they admitted to killing somebody and they wanted to be a monk. And so, of course, that's evil. But the moral of the story is, the monks will see people who are going through psychotic episodes, going through schizophrenia, going through manic episodes such as bipolar, and they don't want to be on medications, but they want God to heal them or they want to be saved. So one of the monks asked me, what do I like about being a psychiatrist? Because when you deal with a lot of these negative emotions, these challenging life situations, these people, they have these negativity and this frustration, and when they can express that onto others, like project those feelings onto others. And in fact, as a therapist, you're often like a container for a lot of these negative emotions or frustrations, and you got to sort of bottle that and channel it in a healthy way. So I began to reflect, what is it that I like about being a psychiatrist? Like, why put up with some of this stuff? And as a psychiatrist, and this is true about really a lot of medical professions, is that these people are often suffering. And being a psychiatrist gives me like an ability to help them with their suffering, help them with their quality of life, help them to be more functional and more present, whether it's for their families or their jobs or their relationships. And so that part of being a psychiatrist can be very rewarding and fulfilling. Also, being a psychiatrist, you meet a lot of unique people. So for example, in my clinic day, I can see someone who's from India, from Europe, people who quote unquote identify themselves as rednecks. So I meet all sorts of different people just sitting in my office trying to help alleviate their suffering with a combination of medications and talk therapy. I can meet people that are rich, meet people that are poor, doctors, lawyers. You get all sorts of people that need mental health assistance. Other things that are pretty unique about a psychiatrist is that almost in any major city in the United States, you're going to have a job available for you. And the job is going to pay pretty well, pretty competitively. And the hours can be flexible. If you want to work night shifts, you can. If you want to work from home and just virtual visits, you can. If you want to go to a hospital or a clinic, you have those options as well. But with any benefits, there are some cons that one has to consider when being a psychiatrist. Again, you're dealing with people that have oftentimes grown up in traumatic environments. Maybe they are victims to their disease. Maybe they're addicted to something and they just can't get past it. And you got to kind of really process that in a healthy way and a constructive way. A lot of times you may be dealing with people who don't understand the severity of their illness or don't think they need treatment, even not just the patients or the family members. And so you got to navigate those also in a healthy and constructive way. At the end of the day, there can be some emotional drainage that being a psychiatrist can bring. The days can be exhausting, it can be tired. It can be a bit stressful, especially if you and your patient are not seeing eye to eye. Perhaps the patient's really set on wanting a specific treatment and going one way, and then they aren't willing to listen to other directions to help with treatment. Perhaps someone's very stubborn about the use of drugs or alcohol to try to cope or deal with their issues, and then they're just not going to get much better if they don't follow the directions by cutting back on the drugs or alcohol, by being sober, etc. Maybe it's a spiritual problem that someone is going through and they are atheists or they don't see the need for spiritual assistance or a community support like that. And so they refuse some of those treatments and they just look more superficially for like a quick fix through medications. But the medications can only do so much. In fact, psychology and psychiatry can only do so much. One of the books I came across really touch upon it nicely is that mental health has some truths, but not the absolute truth. Really, the absolute truth we find is through Christ and Christianity. Yes, Christ can use medications, he can use therapy to help heal people and help bring them healing. And so perhaps the medications and therapy are an important part in the process. But be sure to get in touch with that spiritual aspect aside, because ultimately God is the one who provides health and healing, and he works through doctors, he works through the medications, he works through people in the community to help people. So those are just some things what I like about being a psychiatrist. Be sure to subscribe to the channel to help support the channel and like the video for more videos like this one.